Good morning and welcome. My name is Dr. Libby Saunier, and I'm the Chief Executive Officer of the Louisiana Policy Institute for Children and co-chair of Go Far Louisiana. LPIC is a nonpartisan independent source of data, research, and information for policymakers and stakeholders on issues related to early care and education for our young children birth to age 4. One of our initiatives, Go Far Louisiana, is a statewide movement dedicated to ensuring every child has access to high-quality early childhood education, health, and development services. In partnership with the New Orleans Health Department, Go Far Louisiana and the Louisiana Policy Institute for Children are hosting today's event to highlight two recently released reports related to home visiting programs in our state. The first is an evaluation of the Family Connects program in New Orleans, and the second is the final report by the Postpartum Newborn Nurse Home Visiting Task Force. Before I introduce our moderator for today's press conference, I want to take a moment to thank the W.K. Kellogg Foundation for helping make this work possible. At this time, it's my honor to introduce today's moderator, Dr. Jennifer Avegno, the Director of the New Orleans Health Department. Thank you for leading today's program, Dr. Avegno.
Thank you, Libby, and good morning, everybody. I'm really excited to be here as we gather to discuss the importance of early childhood health and critical programs that support our most vulnerable families. So today I'm excited to give you an overview of our groundbreaking initiative within the New Orleans Health Department that we started about a year and a half ago. It's called Family Connects New Orleans, an evidence-based nurse home visiting program that's making a significant difference for families in our city. Family Connects is a free, voluntary program that provides in-home nurse visits to families with newborns. These visits are designed to ensure that new parents have the support, resources, and education they need to provide a healthy start for their babies. This program is grounded in evidence-based practice, and it connects families with healthcare, social services, and community resources to promote long-term health and well-being. In addition to home visits, Family Connects ensures follow-up care, empowering parents to make informed decisions for their family's health and development. And I want to highlight that this is a universal program that's available to all birthing families in New Orleans. And so when we think about why the focus so much on maternal health programs, it's really clear. We know that New Orleans faces challenges and disparities in terms of maternal child health, and addressing these starts with investing in the health and development of our youngest residents in those early days of a family's life. We know this is vital because it provides crucial support during that early period in the first year, when it's been shown over and over again that early interventions can have lasting effects on both physical and mental health throughout the lifespan of a child and can lead to generational economic security. Through our Family Connects program, we ensure that families in need are connected to these vital resources: healthcare services, mental health support, basic economic and social needs, connection to programs for every member of the household, not just mom and baby. And what this has been shown to do is reduce the likelihood of preventable health issues and improve the overall well-being of children. We've already seen significant success, over 900 family visits in just 1 year. And as you're going to hear, preliminary evaluation results reveal that families participating in the program have reduced Medicaid spending, hospitalization, rates of postpartum depression, and most importantly, families love the compassionate in-home care and support from our nurses. So if we're going to change the trajectory of maternal child health in Louisiana, and we must, Family Connects is essential to our broader efforts to reduce health disparities, improve morbidity and mortality, and promote early childhood development. So I can talk about our program for the entire hour, but I'm excited to turn it over to the other speakers and to continue the conversation on how we can collectively support families and improve child health. Throughout the program today, I encourage you to utilize the Q&A box to share any questions you have. There's going to be some dedicated time at the end for a question and answer session where we'll attempt to answer what questions you have. And so now it's my pleasure to welcome our first speaker, Dr. Melissa Golden Evans, faculty at the the Celia Scott Weatherhead Tulane School of Public Health and Tropical Medicine, and the Mary Amelia Center for Women's Health Equity Research. Dr. Evans is a maternal child health researcher who specializes in reproductive health care access and equity issues, and she's proud to serve as part of the Tulane evaluation team for Family Connects New Orleans. Dr. Evans.
Thank you, Dr. Avegno. I am happy to join y'all here today to share some preliminary findings we've had from the evaluation of Family Connects New Orleans. So for the evaluation, we have conducted 45 semi-structured interviews with Family Connects participants who agreed to be interviewed, and they received at least one home visit from January 2024 through September 2024. And these participants were predominantly between the ages of 26 and 40, evenly split between Medicaid and private insurance coverage, and they were diverse in racial and educational backgrounds. And so our analyses of these interviews reveal that participants overwhelmingly expressed positive feedback about their experience with the Family Connects program. And these are just a few of the example quotes from participants. And these were in answers to, would you recommend this program? And everyone had said yes, overwhelmingly. And these were some reasons why. We had a lot of single parents who just needed some extra support. Some people just felt like every woman needs this type of service in New Orleans. And a lot of people also felt like anything that can just help normalize that experience of having a newborn at home is very important. All right. And so the next slide shows that many, like this parent, appreciated the convenience of home visits and the personalized care that they received from the nurses. So when asked why did they decide to participate, so they're introduced when they are in the hospital right after they've had their baby. And this one said it sounded like a really good program. Sometimes you have so many questions and you forget what to ask when you're in the doctor's office and you feel rushed and everything. And she just came to me, so I didn't have to pack up the baby and go anywhere. So this speaks to the convenience of it and just how important the timing is of these visits. And the next slide shows an example of participants reporting feeling supported, reassured, and more confident in caring for their infants after the home visit. One participant specifically said this is a support system. It helps to feel like someone's there to help. And you have someone there to come and check on you from time to time. And it shows that they actually care for you after you leave the hospital to have someone come into your home and talk to you as well. Another mom, she was a new mother and she's a first-time mother. And she said that she helped me understand the basic needs of myself and for my baby. She helped understand me. She helped me become a better mother. So just having someone answer those questions those first few weeks after having a baby. And then the last slide shows an example of how the program emphasizes maternal mental health and the resources provided for postpartum anxiety and depression and how valued those were for the participants. This one said, I would say my postpartum experience probably would have been a little worse if I didn't do that, meaning participated in this program, because I was really, really going through it. I was having breakdown after breakdown. And I even told the nurse about, what I was dealing with. And that's why she suggested me having some me time or just taking some time for myself. So even just, to have someone like give you permission in a way of like taking some time to yourself really was meaningful for participants and something they weren't hearing otherwise. All right, so that's all I have for y'all.
Thank you, Dr. Evans. That's been one of the best parts of this program is hearing the feedback from families and just how much it's meant to them. Next, I'm pleased to introduce and welcome Shelby Wynn, Program Manager of Family Connects New Orleans here at the Health Department. Shelby is a public health leader and a community advocate with a Master of Health Administration from Tulane, specializing in maternal child health, strategic planning, and civic engagement. She serves on the boards of the New Orleans Regional Leadership Institute and the Junior League of New Orleans, driving initiatives that support families and strengthen communities. Welcome, Shelby.
Shelby, you're on mute.
Thank you so much for that. I appreciate that heads up. Thank you for the introduction, Dr. Avegno, and I'm so grateful to be here with y'all today. At the end of February of 2025, we had completed a total of 857 visits, which includes 783 initial visits and 74 follow-up visits, which is all recorded in Health Cloud, which is our data collection platform. Our visits had spanned each residential zip code in Orleans Parish, with the top three notable completions in 70119 with 105 visits, 70122 with 99 visits, and 70115 with 67 visits. Regarding referrals that our nurses made, they had made a total of 442 referrals, with the top three referral destinations being the We Play Center with 81 referrals, our own Healthy Start New Orleans with 52, and Enroll NOLA with 31 referrals. In terms of our participant demographics, our program has primarily served Black or African American participants with 429 participants, followed by our white participants with 195, Hispanic or Latin participants with 64, and a small percentage identified as mixed race or declined to answer. Our participants span various age groups, with the largest representation being in the 31 to 35 age range, containing 234 participants. This is followed by 26 to 30 years of age with 176 participants, and 20 to 25 years of age with 137 participants. The average age of our program participants is 31. Regarding insurance coverage, 478 participants were enrolled in Medicaid, while 280 have private or employer-provided insurance, and a small number have TRICARE. 7 had no insurance, and 11 declined to specify. And lastly, these numbers reflect our ongoing commitment to reaching and supporting families across our community. And we look forward to continuing to make a positive impact and strengthening our efforts. And with that, I will turn it over back to Dr. Avegno.
Thank you, Shelby. We're really excited to see this program grow by leaps and bounds. And our goal is to serve 100% of all families in New Orleans and hopefully Louisiana. Next, I'm pleased to introduce and welcome Zoe Merritz, nurse supervisor at Ochsner Baptist Medical Center. She has 13 years of nursing experience, including 4 years in the Navy. And during her time in the Navy, she worked with military families through support programs focused on maternal child health. Zoe's a registered nurse and recently earned her advanced nurse lactation consultant certification. She is one of our nurses who supports families through Family Connects and will share some of her experiences with the program. Welcome, Zoe.
Thank you, Dr. Avegno. Thanks so much for having me. I'm happy to be here and give an overview of what home visits can look like for our families. Initial home visits typically occur around the 3 weeks after delivery and last between 1 to 2 hours. During these visits, a comprehensive range of topics are covered, including the physical and mental well-being of the mother, a full physical assessment of the baby, including weight and length checks, along with lactation and feeding support. We also review important home and community measures such as lead safety and sudden infant death syndrome, also known as SIDS prevention. Additionally, families are connected with vital community resources, and appropriate referrals are made to ensure ongoing support. Our Family Connects nurses see 2 families each day, 1 in the morning and 1 in the afternoon, ensuring they have plenty of time to conduct thorough assessments of both caregivers and newborns while addressing any questions or concerns families may have. Between visits, nurses have dedicated time for lunch necessary charting. On Wednesdays, nurses participate in a collaborative nurse case conference in the morning, with the remainder of the day reserved for administrative duties, ensuring that every family receives the highest quality care and support. Thank you.
Thank you, Zoe. And I love these great comments here. You know, one of the differentiators of this program is that it is such a deep, comprehensive visit. I can't remember when any of us have had a 2-hour visit with a healthcare provider. And so it really gives a lot of time to build rapport and get to some questions that families might have been nervous about asking because they can tell how much the nurse cares about them and really takes their time. Next, I'm pleased to introduce and welcome our second moderator, Cherie Johnson, who's the Executive Vice President and Patient Care Chief Nursing Officer of Women's Hospital. Welcome, and thank you, Cherie.
Thank you, Dr. Avegno. This is really exciting, and I am very pleased to introduce and welcome Dr. Veronica Gillespie-Bell. Dr. Gillespie-Bell is a board-certified obstetrician and gynecologist and an associate professor at Ochsner Health in New Orleans. She serves as the System Medical Director for Health Outcomes and is the Medical Director of Quality for Women's Services across Ochsner Health System. And she is also the Medical Director of Minimally Invasive Center for the Treatment of Uterine Fibroids. As the medical director of Louisiana's Perinatal Quality Collaborative and the Pregnancy Associated Mortality Review for the Louisiana Department of Health, Dr. Gillespie Bell is a leading force and a force in Louisiana addressing maternal health care outcomes disparities, and she is also a national speaker and advocate. Welcome, Dr. Gillespie Bell.
Thank you so much, Cherie, for that introduction. Thank you, Dr. Avegno, for allowing me to be here to speak today. I had the honor of co-chairing the legislatively created postpartum newborn nurse home visiting task force. Ooh, that's a mouthful. And I think more important than our name is what we did. We were tasked to study and make recommendations related specifically to the Family Connects model of home visiting. And the task force consisted of Louisiana-based physicians, nurses, state and local health department staff, hospital executives, and maternal child health advocates. So a real diverse group of individuals. And in January 2025, after we completed our meetings and our detailed research, the HCR 113 task force released its final report. And so I'm going to give you some of those key findings as well as some of those recommendations from the task force. So in terms of our key findings, when we looked across Family Connects, not only the model that's happened in New Orleans, but across other states that have implemented Family Connects, we saw improved health outcomes. We showed, or we found that there was a reduced emergency room visit rate of by 50%. And hospital stays by 37% for participating infants, while also reducing maternal anxiety and increasing positive parenting behaviors. I think you've already seen that as evidence from the comments that our participants have made, but also we have the actual data to support that. We also found a cost savings. The model demonstrates a reduction in Medicaid costs driven by lower healthcare utilization among participating families and a reduction of $3.17 in hospital billing for every dollar invested in the program. So a $3.17 saving for every dollar invested. So significant reduction in costs. And then also having the positive feedback from participants. What we found, and when we looked across other states, is similar to what you heard today, that families report a high satisfaction with the program, particularly in receiving those timely health and social services and those referrals to those different organizations to meet those needs. And so we had several recommendations from the task force, but two of the bigger ones that we'll talk about today is first statewide expansion. The task force recommended that postpartum newborn home visiting services, such as those provided through the Family Connects model be available in all regions of Louisiana. As already has been shared, we know that we have opportunities in Louisiana to improve our maternal and infant outcomes, and we find overwhelmingly that the Family Connects model is one that helps to improve those outcomes, and so it should be available to all families in Louisiana. And then the other recommendation is to create those sustainable funding mechanisms. So the task force also recommended that the legislation ensure Medicaid and private insurance coverage and reimbursement for those postpartum newborn nurse home visiting services. Again, we find that these are significant in improving our outcomes. And so we want to make sure we have sustainable methods for not only the expansion now, but for the sustainability for Louisiana now and in the future. And I'm going to turn it over back to Dr. Saunier to lead us through our Q&A section.
Thank you so much, Dr. Gillespie Bell, and to all of our speakers, to Dr. Avegno, to Cherie Johnson, Zoe, Melissa, and Shelby. I think that we're going to be able to say mamas and babies are well in Louisiana because of the work that we are all collectively are getting behind right now. So thank you all so much for sharing this information. We are now going to transition into question answer portion, and we have some Q&A already in the chat box. And Bernita asked, What is the referral process, and is there a referral form? Who would like to take that?
I can take that, or Dr. Avegno, if you'd like
No,
to
I was going
jump.
to say, Shelby, you want to talk about how families get enrolled?
Absolutely. So the main way that we enroll families in our program is through bedside recruiting. As Melissa mentioned, we have a program support specialist that will go to the bedside after delivery and educate families about the program and offer them to enroll. And then we will also schedule a visit at bedside as well. Additionally, we are working with all of our local healthcare providers to educate the community about the program so that families can expect that bedside visit. On our website, it's nola.gov/FCNO for Family Connects New Orleans. We do have a referral survey or referral link. So if you are interested in our program, please go to our website, and then we will direct to whichever hospital, be that Ochsner Baptist or Toro, and let them know that you all are interested in the program.
And I just want to highlight again the universality of this. So this is offered to every family in Orleans giving birth at Baptist or Toro. So it's not a referral that you have to meet certain criteria. It's every one of our families that's delivering. And we want them to have heard about it before they deliver, so that, as Shelby said, they're expecting it when someone comes in to schedule.
And I just want to echo that's a conversation we frequently have around the Family Connects program in Orleans parishes. You want to make sure a mom is hearing about it 3 or 4 times. So much so, I've had a friend that had a baby and said, "I'm waiting for the nurse to come visit me." Like, how cool is that our families are already asking those questions? Another question is from Monique. Are nurses at home RNs, LPNs, pediatric nurse practitioners? What's the specialty level?
I can take that as well, or so if you'd like to jump in. All our nurses are RNs. They have experience with labor and delivery and mother baby. So if you want to add, please do.
Thanks so much. And then another question is, what is the frequency of the home visits? 1, more, those types of things.
Sure, I can take that as well. So we offer up to 3 visits. Our program spans the first 3 months of the infant's life. So we usually aim about 1 visit per month, with the first visit taking place roughly around 3 weeks postpartum. And the reason we focus on 3 weeks is because we want to reinforce the importance of that 6-week follow-up visit for mom or birthing person. And then after that, based on the conversation and the experience in the visit, the nurse and the family can decide if a second or third visit is most valuable to that family.
Thanks so much, Shelby. Another question is related to what is the cost estimate to expand this statewide?
That's a great question. And that's something that we're developing now. So the national model that seems to be holding in New Orleans is that it's about $700, sometimes a little bit more per birth in a community. And that's for everything, the entire program, nurses, support staff, visits, et cetera. So that's being calculated statewide. But what I want to highlight is that multiple randomized controlled trials have found a return on investment of at least $3 for every dollar spent on the program, just in terms of savings for the child through the first 5 years of life. And that's generally ER visits. So whatever the fiscal note is, we're going to want to make sure to highlight the expected savings, that we don't expect it to be any different in Louisiana, of having a savings of at least $3 to 1 per birth.
Thanks so much, Dr. Vigno. Another question came in from Bernita. She says she's at Ochsner West Bank and wanting to know if she can share information with her moms from Orleans Parish on the West Bank.
I can take this one. So currently we have contracted with Ochsner Baptist and with Toro. We are looking to expand across the state. Additionally, as Dr. Gillespie Bell said, with our task force. But currently we are interacting with our 2 partners, Toro and Ochsner Baptist.
I have a great question from Nicole, something I think that's all on the tip of on our minds as well, is how can MCOs support this program and initiative?
Well, I think we would hope that MCOs would add this as a covered service, because it, again, it's cost effective, but it's really a tremendous benefit in terms of long-term health outcomes. We had initial conversations with the MCOs when we were starting this program, and then we decided to just go ahead and fund the pilot ourselves. But I think, any statewide expansion or even the sustainability of this program is going to require both MCOs and private insurance to cover it. And I'll just say that there's at least 2 states that have adopted this. So we're not going to be the first to adopt it statewide. And so it's certainly not anything out of the ordinary that an MCO could and should want to support.
Thanks so much. Another follow-up question from Kenneth is, how can we get this program in other regions in Louisiana? And Dr. Avegno alluded to this, and I know Dr. Gillespie Bell and Cherie Johnson and we all are trying to think about how do we get this program in all the regions around the state. And I know that we're having continual conversations with different hospitals throughout the state to think about how we do fund this, but fundamentally we have to make some policy shifts so that it is available, to Dr. Avegno's point, of MCOs, private health insurance, to ensure that we have the funding. Dr. Gillespie Bell, what would you like to add?
I just want to mention just a reminder to everyone that everybody that is listening on this call has the ability to advocate. So if you've heard today information that you think is going to be helpful to your constituents, to the people that you care for in your community, let your legislator know. That's something that I think all of us can do to advocate for this program.
So much for that. Zoe, I'm going to direct this question to you because I recently learned that you earned your advanced nurse lactation consultant certificate. So congratulations on that. Brittany asked that we mention lactation services. Are the nurses referring to CLCs or IBCLCs? Are they accompanying the nurses to the home visits?
So all of our nurses have been mother baby nurses and been trained on the units for lactation services. And if more lactation services are needed at Baptist, I am able to come out to the family homes and see the families before their initial appointment, which is usually around that 3-week mark, and then afterwards as well. We were also referring to other community partners in the area for any kind of lactation services, any outpatient as well as that.
Thanks so much, Zoe. Monique asked another question. We are at FQHC managing high-risk pregnancies that deliver mostly at Toro. How do we connect so that we can connect this with our prenatal care for moms? We'd be interested in integrating so that moms and babies have improved care post-delivery. So yes, let's connect. We'll make sure that happens. And then Patricia asked a question. Can you give the web address for the referral form again?
Absolutely. It's our New Orleans Health Department website. So nola.gov/FCNO. You're also welcome to send us an email, which is fcno@nola.gov. And our office phone number is 504-658-3266 or 658-FCNO.
Thanks, Shelby. And then Nicole wanted to give Dr. Avegno a shout out for presenting at the Junior League. It was a great presentation. She works for a managed care org and will be adding this to her next health equity and pop health agenda. So thanks, Dr. Avegno, for that. Brittany asked a follow-up question. In terms of increasing perinatal workforce, do you believe this program will help increase the number of nurses exclusively dedicated to perinatal care? Who would like to take that?
I can take that, Libby. I think absolutely it will, because there are a number of nurses who really want to work in the home and work with these families as a whole. And nurses are the best teachers. And so this is just going to broaden and offer more opportunity for our perinatal nurses, and then also increase engagement into perinatal nursing as a whole. So certainly.
Thanks so much, Cherie. And then Brittany asked, how do you get community-based perinatal services providing organizations on your referral list?
Excellent question. Brittany, we would love to connect with you. Please give us a call It's 504-658-3266, or please send us an email, fcno@nola.gov, and we are happy to connect. Each Wednesday, as Zoe mentioned, we do have case conferences, and we highlight a community resource or community organization that our nurses can refer to. So please reach out, and we are happy to connect with you further.
And I have one follow-up question for Dr. Evans. Thinking about all the data that you've collected, what is the most striking finding from your perspective that y'all found?
I have been struck with every conversation how much they love the nurses. These nurses are so caring and so open, and they just help them with like physical health questions. You know, parents worry that their babies aren't gaining enough weight, or just their own mental well-being and their confidence in themselves as parents with a newborn, and just how much they appreciate the nurses who come to their homes and the care that they receive. It's just been across the board. Every interview has been like that.
Thanks so much. And also another quick shout out and thanks to the W.K. Kellogg Foundation for really supporting this work. To have the ability for the New Orleans Health Department to say, hey, we really want to dig into this Family Connects home visiting, but as we do it, we want to study it so that we can know how to hum at the right frequency for mamas and babies is really is transformational. And so again, thank you for that. Monique asked another question. At DePaul, we are investigating and developing bundled payment models of care that include OB. Has anyone thought about applying this model or including this in a bundled payment approach?
I'll take that one. So from the task force, and Cherie, feel free to jump in. When we looked at the different models of payment that have been explored in other states, that actually is one of the ways it has been financed in one of the states. They determined, because there's not a CPT for exactly this type of service, a code for the service. And so they looked at all the services that were being offered through the postpartum visit. And they determined what the dollar amount should be for reimbursement, and then created a bundle payment specifically for the postpartum home visit. So not necessarily to be tied in with the OB services prenatally or with the delivery, but specifically for the postpartum newborn nurse home visit.
Thanks so much for that. That was all of our questions, and what a lively question round. So thank you all for fielding the questions that we received today. And again, thank you all to our presenters, and especially to all of you all for attending, for making this part of your busy day. We appreciate that. To learn more about early childhood education in Louisiana, please visit policyinstitutela.org. Also, to learn more about Go Far Louisiana, the website is gofarla.org. And more importantly, to learn more about New Orleans Health Department and the work that's happening with Family Connects, you can visit nola.gov. Again, thank you all so much for being with us today. And we look forward, as Dr. Gillespie Bell said, we are all advocating, and we can all advocate for mamas and babies in our state. So thank you again for joining us today.